Imagine this scenario. You look at your dog, maybe they're just standing there about to eat, and their jaw is just hanging open, totally slack. They try, but they can't close it, can't pick up a kibble, can't drink normally, just hanging there.
How terrifying must that be for a pet owner?
Oh, absolutely. It's not subtle at all.
Right.
That inability to use the mouth is so fundamental. It instantly signals something, significant is wrong.
Right. So we've taken a stack of source material, articles, research vet notes to really do a deep dive into this specific phenomenon.
Okay.
Our mission today is to extract the most important knowledge nuggets about the most common neurological reason for this dropped jaw in dogs. We want to understand what's causing it, how veterinarians figure it out when they see it, and most importantly, what actually happens next, what can be done, and what's the outcome.
Because while it looks, devastating, the story here is often surprisingly positive, provided you understand what's going on. Okay, let's unpack this then. What exactly is this condition that causes a dog's jaw to suddenly just hang open?
So the sources identify it as idiopathic trigeminal neuritis. You might also hear it called idiopathic trigeminal neuropathy or trigeminal nerve palsy.
Right.
That word idiopathic up front is a key part of the mystery. It just means the cause is unknown. We don't know precisely why it happens.
Unknown cause. Got it. So which part of the body is actually involved here?
It all centers on the trigeminal nerve. Think of this as cranial nerve V.
Okay.
Cranial nerves are like the main wires coming directly from the brain to control specific things in the head and face. The trigeminal nerve is the fifth and actually the largest of these pairs. There's one on the left and one on the right side.
Okay, the main nerve wire for the face and jaw. And the sources break down what it does. It's not just one job. Right?
Oh, exactly. It's got a dual role. It provides sensation to the face, the eyes, nose, and inside the mouth. So, feeling touch, pain, temperature in those areas. But critically for this condition, it also has a powerful motor function.
Motor function. So controlling movement.
Precisely. Via one of its branches, the mandibular branch, it sends signals to the major muscles you use for chewing the muscles of mastication. These are muscles like the masseter, temporalis, pterygoid, and part of the digastricus. Basically, the muscles that power closing the jaw and chewing food.
So in this condition, ITN, is it the sensory part or the motor part that's mainly affected?
It's primarily the motor function. The sources describe ITN as an acute, non-suppurative, meaning like no pus or obvious infection involved inflammatory neuropathy.
Inflammation of the nerve.
Right. There's inflammation affecting the nerve itself. And this inflammation specifically targets and disrupts the motor fibers of the trigeminal nerves.
Targeting the motor wires that control the chewing muscles. And you said the source is stressed. It affects both trigeminal nerves.
Yes, and that bilateral involvement is the crucial insight here. Because the motor control is disrupted on both sides, it leads to flaccid paralysis, essentially complete weakness and kind of floppiness of all those chewing muscles.
Right.
Since these muscles are what hold the jaw closed against gravity, well, when they lose all their nerve input on both sides, the jaw just drops open.
Ah, okay. So it's a nerve signal problem causing the muscles to become paralyzed, and that paralysis results in the jaw hanging open. It's not like a problem with the jawbone or the joint itself.
Precisely. The brain is trying to tell the muscles, hey, hold the jaw shut, but the signal just isn't getting through those inflamed nerve wires properly.
Got it. And it's the most common neurological cause for this. How often is it actually seen?
It's the primary suspect for a sudden dropped jaw due to nerve issues in dogs. It's pretty rare in cats, though.
Okay.
It can affect any adult dog, really any breed, age, or sex. Although one source did mention a slightly higher possibility in golden retrievers, but generally it's widespread.
Okay, so when a vet sees that alarming dropped jaw, ITN is high on their list of neurological possibilities. What other signs would you typically see along with it?
Well, the signs are usually very acute and happens really suddenly.
Right.
The primary sign, like we said, is that sudden onset of the dropped jaw because of the bilateral paralysis of the chewing muscles. And it's important to note, as the sources do, that if only one trigeminal motor nerve was affected, you wouldn't see the jaw hanging open like this. You'd likely see weakness and maybe muscle thinning on that one side, but the other healthy side would still provide enough tone to keep the jaw mostly closed. It's the bilateral hit that causes the drop.
That makes perfect sense. You need both sides working together to hold it up.
Okay.
Okay, since they can't close their mouth, eating and drinking must be nearly impossible.
Yeah, exactly. They simply cannot pick up solid food, can't chew it, or maneuver it around in their mouth at all. However, and this is a really important detail for owners listening, the ability to swallow is usually retained.
Oh.
Swallowing is controlled by different cranial nerves, you see. So if you can get food or water to the back of their mouth, or if they can manage to lap up liquids from, say, a shallow bowl, they can often still swallow it down safely.
Okay, so the getting it in and chewing part is broken, but the swallowing it down part usually still works. That's a critical distinction.
It really is. Another very common sign you'll see is excessive drooling. Botulism. This is simply because they can't close their mouth to hold the saliva in or swallow it away normally like they usually would.
Right, makes sense. What about the sensory part of the nerve? Does that get affected too?
The sources mention that maybe about 35% of dogs might have some decreased facial sensation, but that can be very subtle and honestly hard for an owner to notice.
Okay.
Less commonly, maybe around 8% or so, might develop something called Horner's syndrome.
Horner's syndrome.
Yeah, it affects different nerve fibers running nearby. If you see that, it looks like a constricted pupil, a droopy upper eyelid, the eyeball might look a bit sunken, and the third eyelid kind of protrudes up across the eye.
Wow, interesting how a problem with this specific nerve, or things nearby, can cause such distinct and varied symptoms. And importantly for owners, despite looking so incapacitated, the sources say the dog is usually bright and alert.
Yes, their mental state is typically normal, and the condition itself is usually non-painful, which is, a huge relief when your dog looks so functionally disabled. It's more frustrating and disabling than actually painful.
Okay, so we have this alarming, sudden symptom caused by a specific, usually non-painful nerve inflammation. How do vets actually get to this diagnosis then? It sounds like other things could potentially cause a dropped jaw.
You absolutely hit on the key point there. ITN is fundamentally a diagnosis of exclusion.
Exclusion, meaning ruling other things out.
Exactly. This is one of the biggest insights into how vets approach this. The main goal isn't finding something specific that proves ITN, but carefully and systematically ruling out every other potential cause, especially the more serious ones. It's like being a medical detective.
So what's that detective process look like, step by step?
Well, it starts with a really thorough history from the owner.
Okay.
As the onset set in. Any history of trauma, any possible exposure to toxins, have they traveled recently? And critically, what is their rabies vaccination status?
Rabies, yeah.
Rabies is a potential, though thankfully rare in vaccinated pets, cause of jaw paralysis. So ruling it out early based on vaccination history or risk is paramount.
Rabies is definitely something you want off the table immediately. Okay, history first, then the exam.
Yes, a complete physical and neurological exam. The vet will confirm the jaw cannot be closed manually and feels, flaccid.
Right.
They'll assess muscle tone acutely, it's floppy, but over time, you might actually start to see muscle wasting, atrophy. They'll perform a full cranial nerve assessment, checking not just the trigeminal, but also nerves controlling facial expression, swallowing, tongue movement, the gag reflex. The fact that these other nerves are usually normal in ITN helps narrow down the possibilities quite a bit.
And what about obvious physical problems with the jaw itself, like something stuck?
Absolutely essential step. The vet needs to thoroughly examine the oral cavity and the jaw joint, the TMJ. This often requires sedation or even light anesthesia to really open the mouth wide and look carefully.
Makes sense.
Are there foreign bodies, like a stick or a piece of bone, lodged in the back of the mouth? Is the temporomandibular joint dislocated? Is the jawbone fractured? These are mechanical problems that can look similar but need completely different treatment, obviously.
Right, rule out the simple physical stuff first. Okay, what about ruling out underlying systemic issues or infections, things going on elsewhere in the body?
That's where lab work comes in. A standard blood count, chemistry panel, and urinalysis are typically normal in ITN.
Okay.
Their main purpose is really to check for other systemic illnesses that could cause weakness. Infectious disease testing might be done too, like rabies titers or PCR if there's any risk at all. And neosporosis titers are sometimes checked, particularly in puppies, as this parasite can cause paralysis.
And what about looking inside the head, the high-tech imaging and fluid analysis?
Yeah, that's a crucial part of ruling out structural problems. Advanced imaging like MRI or maybe CT scans of the head are often needed.
Right.
These let the vet look inside to make sure there isn't, say, a tumor pressing on the nerve, like a trigeminal nerve sheath tumor, or inflammation or infection within the brainstem itself.
And what do they usually find in ITN cases?
Well, the key is that in ITN, these scans are typically normal, completely normal, although maybe later on you might see some subtle nerve or muscle changes.
Okay. And CSF spinal fluid.
Yes, CSF analysis collecting a sample of the fluid surrounding the brain and spinal cord is often done to rule out inflammatory or infectious central nervous system diseases like GME, which is granulomatous meningoencephalomyelitis.
Another big word.
Yeah, basically brain inflammation. But again, in ITN, the CSF is usually normal or shows only very mild, non-specific changes.
It really sounds like the vet is building a case by just eliminating suspects one by one until ITN is the only likely explanation left standing.
That's exactly it. It's a careful process of elimination to gain confidence. It's not something else that requires specific medical or surgical treatment. Sometimes electrodiagnostics, like EMG studies, can provide additional support by showing that the muscles aren't receiving normal nerve signals, but these aren't always strictly necessary if the clinical picture and the rule-outs are clear.
So just to quickly recap some of the major things that need to be ruled out before settling on ITN. Mechanical problems with the jaw, you mentioned TMJ issues, fractures, foreign bodies, rabies, always a top concern. Obviously.
Crucial.
Infections or inflammation in the brain or nerves, like encephalitis or that GME.
Right.
Tumors. And even you mentioned masticatory muscle myositis, which is interesting because that's the opposite problem, where the muscles lock the jaw closed, but because it involves the same muscle group, it's on the list to distinguish from.
That's a good summary of the key differentials the vet is thinking about, yeah.
All right, so after all that thorough work, the diagnosis is ITN. What's the treatment? Is there a magic pill or, I don't know, an injection to fix the nerve inflammation?
And here's where it's often quite surprising to owners, given how dramatic the signs look. Based on the sources, there is no specific treatment that actually makes ITN go away faster.
No specific treatment?
Yeah.
Really? So what do you do then? How does the dog get better?
The sources are very clear on this. ITN is considered a self-limiting condition.
Self-limiting.
Meaning the body typically heals itself and the function comes back on its own over time.
It gets better by itself.
Oh.
That's remarkable, but what about the poor dog who can't eat or drink in the meantime? That could take weeks.
And that's where the entire focus of management lies, and it's absolutely critical: aggressive supportive care. This is the treatment strategy supporting the dog fully while its body recovers.
Supportive care. Okay. What does that involve day to day? What does that look like?
Well, the most vital piece is ensuring they get adequate nutrition and hydration. That's paramount. Since they can't use their jaw to eat solid food, you need to provide soft, maybe gruel-like food, something easy to swallow.
How do you even get that into a dog with a dropped jaw, though? That sounds tricky.
It can be. You can try hand feeding small amounts, like little meatballs of soft food, placed far back in the mouth, since we know swallowing is usually okay.
Okay.
They might be able to lap gruel or water from a very shallow bowl. Syringe feeding carefully into the side of the mouth is another option, but you have to be incredibly careful about the risk of aspiration, the food liquid accidentally going down the windpipe into the lungs.
Yeah, that sounds difficult, time-consuming, and probably pretty stressful for both the dog and the person caring for them.
It absolutely can be, which is precisely why the sources highly recommend the placement of a feeding tube if the dog is losing weight, becoming dehydrated, or if that hand or syringe feeding is just too difficult or risky at home.
A feeding tube. Okay.
Yeah, feeding tubes like esophagostomy or gastrostomy tubes are small, flexible tubes safely placed directly into the esophagus or stomach under anesthesia. They allow you to bypass the mouth completely and provide measured amounts of liquid food and water directly. It significantly reduces the risk of aspiration and ensures the dog gets the calories and hydration they need for the weeks, sometimes months, it might take to recover. Plus, honestly, they often make life much less stressful for the owner.
Okay, so a feeding tube is a very practical and often recommended step for ensuring that vital nutritional support.
Right.
What else falls under supportive care?
Just monitoring hydration closely and providing supplemental fluids if needed, maybe under the skin, subcutaneously, or through an IV if they're in the hospital.
Right.
Also, if there's any sign of decreased facial sensation or maybe difficulty blinking properly, protecting the eyes with lubricating drops or ointment is important. You want to prevent the corneas from drying out and developing ulcers or other issues.
And those medications we talked about ruling out earlier, like steroids, since it's an inflammatory condition, are they ever used supportively?
This is another point the sources really emphasize. Medications like corticosteroids are generally not indicated.
Not indicated. Why not?
Well, studies have shown they simply do not change how fast or how well the dog recovers from ITN. They don't speed things up.
Huh.
Plus, they have side effects like increased thirst and urination, which can make managing hydration even harder when the dog is already struggling to drink normally, and other potential side effects, too.
Okay.
Antibiotics are only used if a secondary complication develops, like aspiration pneumonia from inhaling food or water. And there's really no evidence that vitamins or other supplements speed up recovery either.
It's interesting, isn't it? We kind of connect this to the bigger picture. This condition really highlights the incredible power of diligent, basic nursing care. When there's no specific drug or surgery, the treatment is entirely focused on supporting the body's own ability to heal itself. Just keeping them fed, hydrated, and comfortable is the intervention.
That's exactly it. You're essentially providing the scaffolding, the support framework, for their nervous system to repair itself over time.
Which brings us, finally, to the prognosis. Given how alarming it looks initially, and the lack of a specific cure, what's the expected outcome? Is it good?
Here is the very good news. The prognosis for idiopathic trigeminal neuritis is generally excellent.
Excellent, really, despite all that.
Yes. Because it's self-limiting, the vast majority of dogs recover fully. It just takes time.
Okay.
The sources indicate improvement in jaw function usually starts to become noticeable within 2 to 4 weeks.
Okay, so usually within about a month, you start seeing signs it's getting better. That's encouraging.
Right. And complete recovery typically takes longer, somewhere in the range of 3 to 10 weeks. Many dogs recover fully within about a month or two, though it can sometimes take a bit longer.
So while it might be a tough few weeks or maybe even a couple of months of really dedicated supportive care, the vast majority of dogs get completely back to normal jaw function.
That's absolutely the expectation. Now, during the recovery period, because those chewing muscles haven't been used properly for weeks, they may develop what's called neurogenic atrophy. They can look visibly thinner, giving the dog sort of a sunken-in look over the temples and cheeks.
Oh, okay.
But the sources reassure that this muscle mass usually comes back pretty well as function returns. Recurrence is considered rare, but it's not impossible. It could happen again.
Okay. So what are the absolute key takeaways for you, the listener, particularly if you ever encountered this situation with your own dog? What do you need to remember?
Yeah, the essential points from the sources are, first, while it looks terrifying, remember ITN is temporary and almost always resolves spontaneously. You need to be patient. It takes time.
Second, there's no specific cure. The entire focus is on providing that aggressive supportive care at home, often with significant veterinary guidance and support.
Third, nutritional support is absolutely vital. This is not optional. You need to find a reliable way to get enough calories and hydration into your dog. That might be careful hand or syringe feeding, or, very commonly and often highly recommended, placement of a feeding tube for safe, consistent support during recovery.
Fourth, the diagnostic process, all those tests, they're important for your dog's safety. Ruling out other potentially more serious causes, especially something like rabies, is a critical first step before settling on ITN.
Fifth, monitor closely for any complications like ongoing dehydration, weight loss that you can't manage at home, or any signs of aspiration pneumonia that might look like coughing or difficulty breathing, which require immediate veterinary attention.
And finally, maybe be aware of the potential costs involved both in the diagnostic workup to rule out other conditions and potentially the cost of placing and managing a feeding tube. And if your dog is properly vaccinated for rabies, be prepared to share that info while also understanding why a vet must still consider all possibilities, just to be safe.
Absolutely. And referral to a board-certified veterinary neurologist can also be really helpful, providing valuable confirmation of the diagnosis and helping guide those supportive care strategies if needed.
This has been quite a journey then, a deep dive from a really terrifying initial sign through the complex detective work of diagnosis to the surprising lack of specific treatment, the absolutely crucial role of supportive care, and ultimately the excellent prognosis. It's a real lesson in patience and diligent care.
It really is. And there's something fascinating, I think, in the idiopathic nature of this condition. The fact that we don't know the initial trigger, yet the body's own healing mechanisms seem robust enough for spontaneous, full recovery in most cases.
This raises an important question, maybe something for you to think about. Given that the body resolves this on its own with just support, what could that tell us about the nervous system's resilience? And maybe it even offers clues about how we approach other conditions where the cause is unknown. It's kind of a powerful example of the body's inherent capacity to heal if we just support it correctly through the process.